Today we've discussed how the manufacturing community and their related industries are going to use what they learned in 2020 to tackle the public health emergencies of the future. But there's another question. How do we encourage everyone to accept the safety and efficacy of COVID vaccines the government has approved? We were just talking about trust and the absence of trust and how to build it a few minutes ago. Our next guests have been working together to identify this group and to determine how to best reach those Americans who are most hesitant to receive a COVID-19 vaccine. They've learned through polling that conservative voters are now the largest group with COVID-19 vaccine hesitancy. Frank Luntz is a Republican pollster, one of the nation's leading political commentators, one of my favorite people that we have here at the Hill. Representative Brad Wenstrup, I like him too, represents Ohio's 2nd Congressional District and is a member of the GOP Doctors Caucus. Thank you both for joining us today. Let me start with you, Frank. You've been delving into this issue of vaccine hesitancy. What have you learned?
Well, we learned that one of the greatest lines is one that the congressman came up with. And I would emphasize that as a doctor, they trust him. And one of the things that we're also learning is if you would just wear the lab coat, if there are doctors listening right now, you can make a difference. You start emailing your patients. You start creating videos that the people who trust you, because you're the most trusted source. Second is that it's not just Trump voters, it's younger Trump voters and more rural Trump voters who are the most hesitant to getting the vaccine. And third, is that the people who put together this ad, and I don't want to bash the ad council because they do so much good work, but using ex-presidents as the source of information is not going to be nearly as effective as using your doctor and healthcare professionals. And finally, the two arguments that work the best, that this vaccine is more than 90% effective, much more than the flu vaccine, and that 90% or more of doctors offered the vaccine have taken it. Those are the key factoids. Those are the key participants, spokespeople that'll make a difference. And I'm hoping and I'm grateful that the congressman's involved in this because he himself, being a medical professional, he's the most respected person of all in this entire conversation.
Well, Congressman Wenstrup, I interviewed you 9 months ago now for what was then my daily coronavirus report. And you made the comment then, and you said, look, we've got to deal with trust, and the most trusted person in this equation is the community doctor, is the family doctor. Why has it taken us so long to get to what you've known all along and what you told us 9 months ago?
That's a good question because I've been making the suggestions all along. You know, I think back of, say, when Ronald Reagan was shot, we heard from his physicians. They came out in their white coats and talked about what was going on. The difference, I think, of what we've seen is we were hearing from people that actually aren't the ones that see patients every day. Epidemiologists, virologists, very bright people. They have a lot to offer, no doubt about it. But what has a greater effect is the person that you know, the person that you've entrusted into your care. And that's what we're telling people now. That you want to, as somebody said when we worked together with Frank, is they want to be educated, not indoctrinated. And bedside manner is a big part of this. When we were doing this, I put my white coat on at the end. And by the end, there were people that were a lot more trusting of me. I've been giving shots as a soldier, and I've been out with the National Guard doing that. And I can always tell when I'm in uniform, people trust me. When I'm in my white coat, people trust me. My congressional pin doesn't mean a whole lot to them as far as trust. And I get that. And so that's why we as a Doctors Caucus have been trying to be the ones out there, delivering the message. And we were deeply involved with Operation Warp Speed, understanding the safety and the protocols that were administered through this process. This is not just some new technology that somebody made up. It's technology that's been there, but it had the opportunity through this public-private partnership to come through fruition. And the bottom line is they didn't cut corners. They actually had more people in the trials than you normally would have for an approved drug. They didn't cut corners as far as the process, but they did cut corners as far as bureaucracy. When people heard that, it made a difference. When they understood what efficacy meant, that made a difference. And so it was really telling in so many ways. And that's why we're going to continue to push for people to talk to your doctor about the risks, the benefits, the different vaccines, and what may be best for you.
Frank, thank you for that, Brad. Frank, let me ask you a question. I'm trying to make it not loaded, but when I think back about some of the lack of trust that some Americans have in what they're hearing. And I think about California Governor Newsom telling people, oh, don't go out to dinner, don't go out and socialize, and yet he's found at a fancy restaurant. Or Governor Cuomo, we see now much in the news, but in part it was in the news because of hiding COVID-19 data. Or we see various other kinds of comments that have made out there about mask wearing and whatnot. And there's, you know, as you pointed out to me many times, Americans don't like to be told what to do by bureaucracies. How do you get them over so they feel empowered that this is their choice, that they can trust logic, even if they may not trust the government?
And that's the problem, is they don't trust the government. They don't trust Washington. They don't trust politicians. And this is why when the congressman shifted his role from member of Congress to doctor to caregiver, it changed how they saw him, and it changes how they will see this vaccine. And so basically what I'm asking governors is, okay, deliver the first 30 seconds of your press conference. Come back in to thank people for attending, and then get out of the way. I mean, literally, don't speak. Bring the doctors, bring the professionals, the doctors that are closest to home are going to be the ones who are most trusted. Ask them to come with facts. Ask them to come with answers. And the politicians should stand behind them. Cuomo, who is a reasonably good communicator, ended up killing his own credibility by insisting on being the center of attention. The same thing with Donald Trump, that when the politicians insist on being front and center, that's actually a discouraging means. And what we found with the presidential ad is not only did it not influence people, that ad of Forex presence actually turned people off. If you generally are committed to making a difference and getting us up to 85% herd immunity, if you do the numbers, 75 million people voted for Donald Trump. 30 million of those don't want to get the vaccine. If we don't get 20 of those 30 million vaccinated, we'll never get to the 85%. We'll never reach it. And so you need to follow this process. Credibility to start, the facts that people care about, a story which Governor Christie brought forward about the randomness of what the virus does. Because in the end, I'll give you one polling statistic. Among Trump voters in rural communities, they actually think that the vaccine is more dangerous than the virus. If that continues, we'll never get to herd immunity. That's what people like the congressman, doctor, needs to address.
Thank you for that, Brad. I don't know if I'm going to get this question out right, but let me ask you about how you've been able to move some of your colleagues. But there's another dimension too, which are those on the other side of the aisle, because I've talked to both Republicans and Democrats, and I think a lot of them in public, they think they need to spit at each other more than kind of work together. There's just a toxic situation right now, and if you go to a lot of the constituencies that you've been talking to, they feel demeaned, they feel looked down on, they feel like there's somehow it's a way of judging one another. Are you able to communicate to your Democratic colleagues that if they turn that down a bit, it might help, in fact, get people more into this health equation? And then on the other side, on the Republican side, are your colleagues hearing you?
Yeah, I definitely feel that my colleagues on the Republican side are hearing me. And it's interesting you bring that up. And I'm glad you did, because I had a conversation with my friend, Dr. Raul Ruiz from California, emergency room doctor. We've worked together on a lot of healthcare issues, and certainly he's from the other side of the aisle. And I talked to him about what he felt about the vaccine. He's like, oh, yeah. And I said, we need to do some work together. And again, as doctors, we need to be doing that work together. And, throughout this whole thing, this is a moment in time in our history with this pandemic where in my mind, it should have been something that brought us together as a nation. It's a shame it was during the presidential election year, because it tore us apart as a nation. And that is a shame that has happened. And then, what was mentioned before, Americans don't do well after like age 5 to just accept because I told you so as an answer. That doesn't work very well for them. And so we have to recognize that. And that goes to the bedside manner. And it's okay to hypothesize and be wrong. I thought that the experts were right when they said probably by summer this will go away like the other coronaviruses do. Well, guess what? It didn't. And that's what you have to come out and tell the American people. And when you say you don't need masks and then you say you do, you have to give a reason as to why you changed your mind and be transparent about it, because otherwise people think, well, you don't know what you're talking about and I don't know how to trust you.
And give everyone credit. Why is so hard with Joe Biden saying that thanks to Operation Warp Speed, thanks to President Trump's efforts, we have these vaccines? What is so hard about Donald Trump saying, thanks to Joe Biden speeding up the process, more people will get more access to more vaccines in a faster way? Give credit. This is what we're taught as children. There's no amount that we can accomplish if we don't care who gets the credit.
Ronald Reagan.
Yep.
Ronald Reagan.
Let me just ask just really fast, because we are out of time, but Frank and Congressman Wenstrup, one of the things that I love about this and what you've done, and I'm so happy you're both on this today, you both changed your schedules to make this happen, is you're listening to people. I mean, you're actually listening to people. I lurk in some of Frank's his focus group sessions. I'm sitting there watching, and it's hard to listen to people. Sometimes it's cacophonous. But I guess my question to you, Frank, is what are you going to do with this? And I think the broader question is, shouldn't we all be listening to people more?
Well, I had the Bill Cassidy, the senator of Louisiana, obviously the congressman from Ohio. I had Kevin McCarthy, the Republican leader, Chris Christie, the former governor, as well as Tom Frieden, representing the CDC. This is what I'm going to do for the rest of my life, is to bring these voices, bring their opinions, bring their concerns and their misconceptions to members of Congress so they can be addressed. We may have walls outside the Capitol that keep constituents out. My job is to create these focus groups that bring constituents in. And the congressman here is one of the most engaged people in Washington, and thank God for him, because he's going to save lives because of it.
Oh, thank you.
Quick final thought, Brad?
Well, I think that Frank is right. Yeah, we did tear some walls down by being able to talk to people and hear what they have to say. But you asked what we're going to do. We're doing things like this with you today, Steve. It's important. You said we changed our schedules. There's a reason why, because what you're doing is important work. And if we can reach out to more Americans in any venue possible like this, we want to do it. So I want to thank you for having us on today to share this message with the American people. And I encourage people, reach out to my office. And, if you want to have a conversation or get some facts, we'll try and get them to you, because it is important that we do that. And so we're going to continue to reach out with every opportunity that we can. So thanks so much, Steve.
Well, I've done a lot of talks with Frank Luntz in the past, and he always says, don't be too nice, I won't believe you. So I just say, Frank, you did pretty well today. Not too bad. Frank Luntz, iconic pollster, great to have you on. Congressman Brad Wenstrup of Ohio, member of the Doctors Caucus, thank you both for sharing your views and thoughts with us today.
Thanks, Steve. You have a good day.